Hi, my name is Luciano Costa. I'm a myeloma physician at the University of Alabama at Birmingham. At the ASH meeting this year, we have a poster that compares the results of the STORM trial with a similar cohort in the Mammoth study. So as many of you might know, the STORM was the study of Selinexor and Dexamethasone on patients who were triple-class refractory multiple myeloma, and that's a trial that led to approval of Selinexor in the US. Because it's a single-arm trial, not a lot can be concluded about overall survival other than describing it. So what we did with this study, we took our database of the Mammoth study, which is a study that we performed with 14 academic institutions and was published early this year in Leukemia, describing the outcomes of myeloma patients once they become refractory to the CD38 monoclonal antibody. So we match patients on STORM that received Selinexor as the first line after they had become refractory to a PI, an IMiD, and to a CD38 monoclonal antibody, with similar patients on Mammoth, and describe their response to the next line of therapy and their survival. We had 64 patients on the STORM and 128 on Mammoth meeting those criteria. The cohorts were surprisingly well balanced since we are comparing a trial with a retrospective observation. Similar number of prior lines of therapy, similar proportion of high-risk patients, and similar exposure to prior agents. The response rate was higher with Selinexor dexamethasone, 33% versus 25%, and the overall survival was higher, was about a little bit over 10 months with Selinexor and dexamethasone, and around 6 months in the Mammoth study. Even though this does not replace a randomized prospective trial, it provides some early and preliminary evidence that Selinexor might be having an impact in survival on patients with triple-class refractory multiple myeloma.